Hey guys, Dr. Kyle Lovelace here with Queen City Health Center. My wife and I have two clinics in the Charlotte area, one in Matthews, one in South Park. And hey, today I'm going to talk to you about back pain, low back pain actually, and sciatic nerve issues. This is a huge topic, and the reason I know it's a huge topic is because the number one doctor's visit for people right now in America, the number one reason people go to a doctor is actually for low back pain. That is across the board the number one thing. All of us have experienced it at some point in our lives, whether it was an acute, quick issue that went away, or maybe you have chronic low back pain. But we all know that that is a very common thing. It's the world we live in today. We're sitting all the time. Because of the amount of sitting that we're doing, we're in a position where our spine's not moving, and when our spine doesn't move, it begins to break down and we start to feel pain from it. Big things I want you to understand about low back pain is that most of the time when you start feeling low back pain issues, the problem has usually been there for a while. It's a true story. It's not usually something that so let's say, here's a good example. A patient comes into our office and they had back pain that just started about 2 weeks ago, not really sure what happened, just started being sore, or maybe they just picked up a pin and their back went out and they think that that problem started 2 weeks ago. Well, here's what I'm going to tell you, that it didn't usually start 2 weeks ago. Usually it's 5, 10, 15 years ago when the problem started, because only 9% of all the nerves in our entire body actually feel pain. That's huge. That means 91% of the rest of the nerves in your body are for functioning and healing of your body. It's not actually for symptoms like pain. So most of the time you have a problem that has to get bad enough before you start to feel it. And that makes sense too, because if you go pick up a pin and your back goes out, obviously that shouldn't happen unless there was so much pressure that built up that all it took was that one little thing of picking up a pin and you had a disc herniation or back spasm or whatnot. So we know the back pain is a big deal. We know that most people are dealing with it. And here's the thing about back pain is the medical options for it are going to be very slim and extremely ineffective. And I can say ineffective, one, you can just look at our world today and know they're ineffective, but it's research-wise. There's nothing in the medical setup right now that can actually beat the placebo when it comes to getting rid of back pain. So if you go to your doctor right now, they don't have a lot of training in it, but what they'll typically say, if they don't do x-rays, or even if they do, typically when they see x-rays, they say there's no problem, it's just a muscle issue, here's a muscle relaxer. So you get that muscle relaxer, pain med, try to get rid of the pain, problem doesn't go away, go home, take some ibuprofen, get rid of the take an anti-inflammatory, get rid of the inflammation. If that doesn't work, the next step typically is going to be a steroid shot. If that doesn't work, many times they might try physical therapy. Again, physical therapy, though, hasn't beaten the placebo when it comes for back pain, so it's not really doing much for chronic back issues. The final step, if all those things don't work, guess what the next step is? Back surgery. The problem with back surgery is extremely ineffective, especially things like fusions, where they actually put the two vertebrae together and fuse them with metal, or they'll put a cement disc in between. The problem with that is it's about a 17 to 18% success rate long term. And what I mean by success rate is that you have pain-free, not without taking medications, but that if you're pain-free, you're taking medications. So we know that this stuff, it doesn't work. It's extremely dangerous, extremely bad on your spine, because your spine, the key to health, just so you guys know, is spinal movement. 90% of the stimulation and nutrition to your brain comes from your spine being able to move. If we fuse your spine together, that means it can't move. That means it's actually causing damage to your entire system. Your nerves that control every organ, tissue, cell in your body come out of the holes in your spine. Your brain, you see the head up here? Your brain has to send signals down the spinal cord, which is encased in this spine, and those nerves come out. They go to muscles like you see on this picture, but those nerves also go to your heart, they go to your lungs, they go to your digestive system. So if I have damage in the part of my spine or the nerves that go to my heart, and it's going to affect the heart, I'm not going to feel it right away, but if they go in and they fuse that bone, it is absolutely going to have an inflammatory, you're going to have scar tissue, you're going to have an increased stress response in that area. It puts your body into a constant stress response. So hopefully I hit hard on that fact that you definitely don't want to do surgeries. Really, the recommendations, it's crazy, because the medical recommendations for a spinal fusion are that they're not supposed to happen unless you actually have two vertebrae and one is slipping or there's a fracture. Right? They're actually not supposed to be doing this. In America, we have 40% more spinal surgeries than any other country. 40%. That's huge. And it directly is correlated with the amount of neurosurgeons that we have. I have had multiple spinal surgeons come to our office for their family members because they won't do surgery on them. This is no joke. I've had patients with scoliosis that we help reduce their scoliosis, reduce the symptoms, and this is a spouse of a neurosurgeon who typically would have done surgery. And when I asked them, I said, well, so are you going to refer to us? The response was simple. It was, well, that's kind of out of our scope of practice. This is real deal. I can't make this stuff up. So here's the deal, guys. I want to talk to you about the top 5 things you can actually do. 4 of these things are going to be stuff you can do at home. The rest is, the other one is going to be something you do have to go seek treatment for, but it's going to be highly effective, and I'm going to highly recommend doing it. So the first one, let's dive into this. Well, first of all, let me tell you what sciatic nerve issue, obviously you know what back pain is, but let me tell you what a sciatic nerve issue is, okay? Your sciatic nerve is this big yellow nerve right here that goes all the way down to your feet. And it starts out at the L3, L4, L5 area right here, okay? And all these nerves come out and they come to this big old trunk of a nerve that goes right through a muscle right here called the piriformis. And this is where you can feel it. If you sit too long, many times you can hit that nerve. And it goes all the way through. It goes to the back of the knee, side of the knee, front of the knee, comes around into the foot. It can start sometimes as a pain down here and work its way up. It can start as a back pain and work its way down. It can start in the middle. It all depends on what nerve root is being interfered with. Now, there's a lot of people that tell you that sciatic nerve issues will come from a piriformis issue. There can be cases, because it goes through that piriformis muscle, where inflammation in that muscle or tightness in that muscle is hitting the nerve. At the same time, though, the tightness in the muscle, I want to know why that muscle is tight. Why is this one tight and not that? Typically, it's from rotation of the pelvis. The pelvic rotation, along with activities that you're doing, are going to create an inflamed or tight piriformis muscle. So just releasing the piriformis muscle might help for a short bit, but it's not getting to the root cause. In my experience, I've been in practice now for 10 years, and I've seen, I would say at least 2 or 3 times a week, somebody comes in with a sciatic nerve issue. So you can do the math. So I've done a lot of work with this. Typically, it's going to stem from the lower back. The majority of patients, when we start to get their spine moving, the sciatic nerve issue goes away, because it's direct pressure either from a disc, or there's inflammation in the joints here that are affecting the nerve, sciatic nerve going down your legs. Okay, so if you're dealing with a sciatic nerve issue, a low back pain issue, you have to look at the spine and the nervous system first. Okay, that's where everything starts at, and then we can work our way out from there. So that's what sciatic nerve issues are, and I'm going to walk you through some things to help with it, possibly even at home. So the first thing with sciatica or low back or sciatic nerve issues is to, these are in no particular order on how you should do them, but the first thing I'm going to recommend is look at your diet. A lot of people don't think about that. When they think of pain, they don't always think about what are you eating. And even though that might not be the root cause of your problem, it can definitely make your problem worse. When you go to the doctor with a sciatic nerve issue or back issue, they're going to recommend anti-inflammatory. Well, I'm going to recommend following an anti-inflammatory diet. Instead of taking something like ibuprofen, which can increase your risk of a heart attack with up to 20% within the month that you take it, I'm going to recommend following an anti-inflammatory eating plan. Okay, that means stuff like removing sugars, taking a lot of sugar out of your diet. That means stuff like taking grains, a lot of grains out of our diet, reducing the bad fats like canola oil, vegetable oil, safflower oils, these really inflammatory foods that you're going to get at fast food restaurants, right? Or most all restaurants when they cook the oil, a lot of fried foods that we're going to get, and changing that into more of an anti-inflammatory diet. Now, I can do a video on just the anti-inflammatory diet someday, but ultimately reducing inflammation. Start to research what an anti-inflammatory diet looks like, and you'll absolutely learn a lot just from the Google searches on anti-inflammatory diet. So number 1, reduce inflammation. The reason this is important is because most of the time inflammation is what's causing your pain. A great example of how diet can actually change inflammation and get rid of symptoms. Growing up, I played soccer my whole life. Avid soccer player, played club soccer, high school soccer, I played in college, and towards the end of my college career, I went up one time to head the ball out of the goal, on defense, and I landed both of my knees on the back goalpost. Both of my knees on that back goalpost, literally 2 knees on a piece of metal, and I had knee pain for about 5 years after that. Well, when I got into chiropractic school and I started learning more about nutrition as well, I realized that if I change my diet, it'll help with inflammation. I changed my diet and all my knee pains went away. All I did different with my knees was change the diet. I was still doing everything else the same. So literally reducing inflammation in your body can have a huge impact on your knee pain. So rather than just taking an anti-inflammatory drug or medication, do it the natural way. There's plenty of natural things you can do. You can also take turmeric. Turmeric's an amazing herb, or root that you can use to reduce inflammation. You can do it in powder form, you can do it in capsular form, and there's certain things you want to look for in a turmeric supplement as well. But key is anti-inflammatory is super important. The next one is certain let's say certain exercises that you can do at home are very important or can be very helpful. Number one, stretching the hip flexor muscles in your spine or around your spine that connect to your pelvis and into your legs. And hip flexor muscles are the muscles that take your pelvis from being in this position. Let me show you on the spine. From being in a position, so this is normal. Hip flexors, if they're really, really tight, it'll cause your back to do this. You can see the compression that's going to happen in these joints. So now your back does this, you get compression into the joints. These are all the nerves that come out. These are your sciatic nerves right here. They start. So coming out of there, when you compress down, you create inflammation in there and absolutely can put pressure on those nerves. So getting rid of pelvic flexion by stretching the hip flexors. Easiest hip flexor stretch I can share with you right here on video. You can, best idea, go on YouTube and Google hip flexor stretches and you're going to find a ton. But here's the easiest one. You put one foot forward. This is the hip flexor. I'm going to stretch the left leg. If you can't see this, my left leg's here. And you just literally lean forward, reach up, and you're going to stretch your psoas muscle. You're going to stretch the hip flexors through here. And over time, that can help release that. Now, most of the time, our hip flexor muscles get extremely tight because we sit all day, okay? So changing the amount of sitting you're doing can be a big part too. The other one is you can stretch your hip extensor muscles, okay? So those are the opposite, or even the piriformis, by lifting the knee up and stretching the butt muscle back through here. So you can YouTube. The reason I'm not going through all these with you is because there's so many good videos out there. They're super simple. You can YouTube piriformis stretch. You can YouTube hip flexor stretches and hip extensor stretches, and those are going to help stabilize or relax the pelvis from so much sitting that we do. It's huge. So certain exercises or stretches you can do. Other exercises you can do are going to be stretches like this, or strengthening exercises where you're strengthening this lower part of your back. The final one that I recommend the most is going to be things like planks, strengthening the core. If you're an athlete, if you run a lot, you know that your abs are the first thing that usually get tired, and that's what can lead to back problems if you have a weak core. If you sit a lot, you most likely have a weak core. So doing things like planks every day or every other day and ab workouts can help us strengthen the core, which will help make your low back more stable. Really good. You can also do balancing techniques like getting on a Bosu ball, putting both knees on each side of it and trying to balance yourself. Or getting on one of the smaller balls you stand on and you're just trying to balance with one leg over time. There's a lot of the core exercises. So you want to look up core strengthening exercises as well. So exercises are going to be core strengthening and then the proper type of stretches. The next thing I want to talk about, and this one seems like it could be easy, but it's actually more difficult in the world today that we live in than you think. So sitting less. Again, I said this in the beginning, but 90% of the stimulation and nutrition to your brain comes from your spinal movement. When you sit all day long, you're literally deteriorating your body. Also, these disc spaces. So I'm going to show you this. This will be pretty helpful, I think. So in between the vertebrae, you have discs, right? Well, these are fluid-filled sacs within the disc surrounded by ligaments, okay? Now, when you have a disc herniation, it's when the fluid gets outside of the ligaments, herniates, and many times will come. You can see that red thing right there. That's an example of a disc herniation. Disc herniations happen when there's so much pressure into this disc that those ligaments slowly begin to tear. If it's a big something like a car accident, it's a big tear and it happens all at once. But it can slowly begin to tear, and what will happen is one day, after sitting for many years and putting tons of pressure into those discs, one day you go and you pick up a pen and you get stuck. You hear the pop. The disc blows, you literally rupture a disc, or you herniate, or you bulge the disc, puts pressure on the nerve, and now you have to start to have back pain, sciatic nerve issue. If it gets bad enough to where it's actually sequestrated or sticking far enough out, then it might have to have a surgery. It might be something we have to remove the disc. That'd be horrible. There's a lot of therapies you can do, specific things that we even do in our office. If it is a herniated disc, something called decompression that can help suck that disc back in with certain exercises. So my point is when you're sitting all day, that disc will either herniate over time from too much pressure into the joint, or it can dehydrate. Okay, if we don't move this joint, just like any other joint in our body, the fluid is not replenished. There's something called imbibition. Okay, you can look that word up, but imbibition is when you move your spine, when you move these joints, fluid goes out and new fluid goes in. So old fluid is taken out of the disc, new fluid is put into the disc. It replenishes the disc space. Movement is key. If you sit a lot, you're not getting the movement. So I don't recommend any more than 20 to 30 minutes at a time of sitting. You can get a cushion full of air. They're wobble cushions. We use these in our office and can give them to patients, but you sit on them while you're typing, right? And you can move. So you can keep movement in your low back while you're sitting. So it doesn't necessarily mean you have to quit your job, but it does mean you got to get moving. Okay, if you're sitting all day long, you're dying quickly. That's the facts. Right? It's physics. Movement is the key to life. Exercise, sitting less is huge. Let's see, what's the last one? The other one I was going to do. So anti-inflammatory exercise, sitting. Here you go. Well, I'm going to move into this one. This is the one that we're able to help people. So if you've tried an anti-inflammatory diet, you've tried exercising, stretches and things like that, you've tried sitting, there's other things like massage that can be helpful as well. But then the other thing, if you've tried all these things and nothing has changed, or you're still having pain, it hasn't gotten rid of it, then the next step is chiropractic care. And chiropractic care is so effective at so many levels with back pain. It's so effective with all types of health issues because it removes the interference from your body's ability to heal, and it heals itself. So what happens is that sciatic nerve right there, whether it's from a disc or from inflammation around the joint, the subluxation where the vertebrae doesn't move, it'll cause irritation to the nerve, and that's where the sciatic nerve issue. Typically within 12 to 24 visits, you can see it, many times less, but minimum, it's usually about 12 to 24 visits, you can see a huge reduction, if not completely gone away, with sciatic nerve issues. Some of the things we do different are decompression with the disc issue. It's a table you lay on that decompresses the disc. The other thing that we do is we adjust, moves the spine, gets pressure off the nerves, we help break up scar tissue through certain therapies, and then help retrain the muscles. Remember when I talked about the core strength? If you just adjust the spine, you can get rid of pain. But what's going to keep it from coming back? Because your body has a muscle memory to be where it's at. So we also have to retrain the muscles. So we work on retraining those muscles as well. The other thing we do is a certain technique. If you're in so much pain, over and over we'll have patients that come in that they can't barely move. But we have certain techniques, blocking techniques that we use that will actually allow you to lay there without us putting a ton of pressure into your spine because it's painful and it's barely moving anyways. That will help relieve the pressure off the nerve, so then we can get in there and start really adjusting. Okay, so there's a lot of techniques for that, but chiropractic care across the board, this is the only thing right now that has beaten the placebo when it comes to helping with low back pain, meaning they did fake adjustments, they did real adjustments, and the real adjustments beat the placebo in the results. So it's not just we think it's working, it really is working. It gets your body healing better. Okay, so chiropractic care is huge. Just want to make sure there's nothing else I want to say about that. Yeah, and then another thing, a good chiropractor is going to take x-rays. They're going to see what your spine looks like so they know what they're working with. If they feel like you have a disc issue, an MRI. Right? At the same time, a good chiropractor is going to put you on a plan to get results. Sometimes I have patients that come in and just say, I just want to get adjusted, get my neck cracked, get my back cracked. I just want to get adjusted real quick. I don't want to go through a plan. And you know what? I'm here to meet you where you're at. But at the same time, why not set some goals, right? Put together a plan of action, follow through on that plan, so now we get a long-term result. Because you could lay on the table, I can get you adjusted, I can get your spine moving up very well, and you might get rid of pain, because we're really good at helping people get rid of symptoms quickly. The problem, the matter is 2-3 months down the road, that problem comes back, and then you think it didn't work. But if you get you on a real program, real correction, now you have a long-term fix, but also it makes sure the rest of your body's doing what it's supposed to do. That is so important. So chiropractic care is essential. The final thing, I'm actually kind of forgetting what my final thing is, so I'm going to go with something that I know works, even though I think it was something else I was going to say. I just love it when that happens. You get talking so much and you kind of forget what you're talking about. So chiropractic care is the last one. The final one is, these are some supplements that have been shown to be effective for helping with low back pain, mostly because they reduce inflammation. One of them is, because everybody wants to know what the best supplement is, one of them is vitamin D. Okay, so vitamin D3 has been effective for low back pain. Magnesium is effective for low back pain. And then the final one are fish oils or omega-3 supplements. Okay, those all help reduce inflammation. Magnesium makes sure that your muscles are working properly. Your muscles have the nutrients and minerals, or the minerals that they need to not spasm, because low magnesium levels can cause muscle spasming, and that can be very common as well, because we do have many people have a deficiency in magnesium. So those three things right there are really important. Also, obviously, drinking lots of water. I don't know how I wouldn't think about that one. H2O. So that's my final thing here. Get enough water in your body. The first thing that dehydrates when you're dehydrated or not have enough water is your disc spaces. We know our discs are the cushioning for our spine, and they are essential to make sure we have the proper movement and to make sure that our spine is healthy. Okay? All right, guys, so here it is. Anti-inflammatory diet, exercising with specific hip flexors, hip extensor exercises and stretches, sitting less, chiropractic care, vitamin D3, magnesium, fish oil, and then get enough water. That's essential. Now, there's plenty of things you can do for low back pain that I didn't write up here, but those are 5 things that are highly effective. Over 10 years of practice and helping patients over and over again with back pain, I can tell you right now that these things work. The biggest thing I always recommend is no matter what you try, even if, let's say you stretch some and your back pain goes away, I would still recommend going to a chiropractor, getting evaluated to make sure, because here's the thing, what if you stretch just enough to get pressure off the nerve causing pain, but you actually have a major area in your back that's not aligned properly or it's subluxated, and it's causing pressure on the nerves going to your female organs, right? And causing menstrual cycle issues. Or it's going to the nerves right above that go to your digestive system, and it's causing constipation or diarrhea. Or to the nerves that go to the male organ, causing ED or prostate issues, right? So all the nerves go to the nervous system, from the nervous system go to organs as well, and only 9% are for pain. So even though we want to get rid of pain, because I don't want you going into pain meds, muscle relaxers, surgeries, anti-inflammatory supplements, steroid injections, and then finally, opioid addictions and all the stuff we're seeing right now, I don't want you to do that. At the same time, I don't want to just get rid of your pain. I want to make sure your body's functioning and healing at a massively high level so that your body is more resilient to stress and that your body can be healing the way it's supposed to. Okay? All right, so that's it, guys. Thanks so much for watching. Like this, love it, and share it. Back pain is the #1 reason people go to a doctor right now. Many people are confused about what chiropractic care is too, and so this could be a great video to help them understand it more in depth. And share this stuff. Comment below if you have any questions. If there's anything else you want us to talk about, let us know, and we'll shoot a video on that as well. All right, you guys have an awesome day, and we will talk to you soon.